Hello, hola, and namaste. I'm Darshana, and I'm going to be your host in this virtual space, Pelvic Gyan, the one thing. I'm a women's health physiotherapist, and I'm hoping to have conversations with a variety of medical and non-medical providers about anything and everything related to pelvic health, from pee, poo, pregnancy, postpartum, sex, pain, and more. This is a passion project to increase awareness and to get the dialogue started. But this is not medical diagnosis or medical treatment. If you have specific health conditions, please reach out to your providers and do not take your medical advice from the internet. Thank you for spending time with me. If you have any questions, comments, feedback, I would love to hear from you. Let's get started. Hello everybody, it's Darshana again, and thank you for being here. Today we're going to talk about a hot topic, which is postpartum running, and I have my friend here, Dr.Carolyn Yates, to help us kind of shed some light on some of the common questions. So I'm going to have her start by kind of giving us a little bit about background.
Yeah, hi, thank you so much for having me. My name is Carolyn Yates. I am a physical therapist, and I have specialized in pelvic floor physical therapy for a number of years now, and have really niched down into helping women around pregnancy and postpartum, and specifically kind of helping navigate the waters of exercise during pregnancy and after having your baby, safely getting back to that and not and really setting yourself up for a good postpartum time, like way past just the first, 6 weeks. I am currently located in Northern California, but I do telehealth. I used to live in New York City, that's kind of where I started my pelvic floor journey. And then I also lived in Colorado. So now I'm in New York, or now I'm in California. Some days I'm like, I wish I was back in New York. And yeah, so that's kind of what I really focus on is, pregnancy, postpartum, and just helping women understand what to do, because I think that it's a huge passion of mine because there's just such little information out there for women.
And I mean, you said it like it's not just the early postpartum, but you're just sort of forever, because we tend to forget that postpartum is forever. Some of the things that we do in that early postpartum period, people can be dealing with for a really long time. So it's important for women to understand it's not just for the first 3 months or whatever. It really impacts how their body's handling challenges after and forever, in some ways. Yeah. So when it comes to postpartum running, what are some of the common things that you kind of deal with people complain? Like, what are some of the common challenges for postpartum moms when it comes to running?
Yeah, I would say the first main challenge is just knowledge, kind of when can I, my doctor said I could go do whatever I wanted, mainly at 6 weeks, most people say that. And just the lack of information and knowledge for women, I would say, is the big overarching problem. And just how to do it safely and how far and all that good stuff. And then more specifically related to pelvic floor disorders and stuff, it would be, prolapse. Some women will be like, I have this pressure feeling. I don't know what's going on. It feels like a tampon is falling out kind of thing, or heaviness. And they don't even know, they don't really know what's going on. And, maybe have talked to their doctor about it, haven't talked to their doctor about it. So that's a big one. And then also incontinence, whether it just be a little bit of losing your pee when you're running, or, you have to stop and walk and go home because you are I'm going to lose all of my urine. Those would be the two, of the symptoms, the two big ones. And then also just pain. I always tell people the pelvic floor is so intertwined and close to our deep core muscles and our hip muscles that having some hip pain postpartum could be related to your pelvic floor. It could be coming from the pelvic floor and stuff. So, I like to educate people on just any pains really in the area could be related to your pelvic floor. So
yeah, so it seems like there is this general readiness that you need to know about your body, and then there is a specific readiness about the pelvic floor, which doesn't simply is as easy as 6 weeks, so go have fun.
right? So, and is that different? Do you see that to be different in people based on what they were doing during their pregnancy? So is there a difference between people who were running during their pregnancy as against people who were last running when they were in high school? Like, is there a difference between readiness just in terms of time frame, how quickly they'll be ready to run?
Honestly, not really. And I think that just comes down to like everybody's birth experience is different and everybody's body is different. Like whether you're an Olympic runner or, you just run you used to just run 3 miles like twice a week or something. You can have vastly different postpartum experiences. And we just don't have like enough research anyways to like really be like, oh, do this before you're pregnant and do this while you're pregnant and then it'll set you up really well for this. We just don't have anything like that. So it's really hard to be like, oh, if you were a big runner before, I'm going to be a little bit more or less concerned, quote unquote, about you running postpartum, right? If you weren't a runner before you got pregnant and then want to run postpartum, like I'm going to have more caution with you and make sure you are strengthening a little bit differently and like maybe ramping up a little bit slower and just like if you were, a regular physical therapist and somebody came to you and was like, hey, I want to run a marathon. And you were like, okay, what have you done? They're like, I have literally never ran a step in my life except to not get hit by a car. You would be like, okay, caution, like let's take it easy. So, but I can't say in my patients that I've seen like, if you were a runner before, you're going to have much better outcomes, unfortunately. And it's just because everybody's birth is different and, your birth plan could go exactly as planned, or you could push for, 10 hours and then have to have a C-section. And that, at least at this point, we don't really have any.
Yeah. So there's that lot of rebuilding that needs to happen irrespective of your previous, activity level. And in some ways that's just, that those are getting the blocks of movement in place before you kind of have a challenging activity. But I feel like there is just a lot of lack of knowledge about what could happen. So why are we so cautious? Like, what are some of the things that can happen if I were to just like, nope, I'm just going to get up and run? And, sometimes because people or athletes sometimes learn to push through pain. Like just like mind over matter. Yes, I'm feeling this symptom, but I decided to finish 3 miles today. So I'm just going to power through, So what are some of the things that we're worried about, especially in terms of like long-term impact that we need to tell women about?
Well, I would say, prolapse would be like the biggest concern. And for anybody listening or watching that doesn't know what prolapse is, it's technically just, where one of your organs is kind of falling out of place because it was held up by some nice, good ligaments and other structures, which got stretched out during pregnancy, which is, totally normal. But you might have started running a little too soon, or it just got really stretched out and your body just hasn't like regrouped in time. And when you add running on top of that, which is a lot of impact, even if you're I always caution people like 10 minutes of running, that is a lot of impact, even though it seems like not a lot of time for some people. It's not a lot of time, but think about how many times you hit the ground in 10 minutes. Like it's a lot. So prolapse, I would say, because of the repercussions down the road and potential of having to have surgery and all this stuff, and it being a hard thing to rehab from, that is my biggest concern. So not running too soon for the sake of not getting prolapse symptoms, I would say is like definitely number one. Mm-hmm. Obviously, incontinence is another one that can come from running too soon. And I also tell people, you might not have any symptoms and you might not be feeling anything, right? And you feel great out running. And maybe you go running before, and I think we're going to get to this, like where I have my like don't run before this time. But if you start running, at 4 weeks or something, you might feel great. And especially my runners who were runners before and they want to get back to, marathons as soon as possible and stuff like that. They might feel really good at 4 weeks and be like, I'm going to go. Like, I feel great. My body feels great. And, my physical therapist or somebody told me like, just listen to my body, my gynecologist or something. But I always caution on that too. because yes, you might not have incontinence right now or any symptoms right now, but they could crop up in 6 months or 5 years. Like, obviously we can't predict the future, and we can't look into the future, or we can't in 5 years say, hey, because you ran it 4 weeks postpartum, this is why you're having this symptom. But it could very much be related. And I just always tell people, like, just wait for your future self. Like, just give it a few more weeks kind of thing. So,
and that is so hard for those who just get the pleasure. For that is the hardest thing to do. And I keep, as you said, I have to keep reminding them that how you feel and how your vagina feels are two different things.
Right.
And they often get told, listen to your body. That's another thing where I have to tell them, no, sometimes just listen to the laws of physiological healing. Right. Don't listen to your body, because those happy hormones are tricking you. Right? So there is that balance of, like, not making women afraid of returning to activity, and at the same time, and pulling back a little bit even when they're feeling great, right? So let's go into these timelines. Like, can you speak a little bit more about, like, what are some of the milestones in the postpartum recovery that one needs to know as it relates to, like, return to run?
Yeah. Okay, well, 6 weeks is like the typical time that women get clearance to go do anything, which I'm like, okay, that's great. That means you're, healed. If you had some stitches, you had tearing, any of that, that means you're healed. And that is awesome. And yay, let's celebrate that. But then I'm like, but take it easy. Don't go crazy. I personally say to no matter what your background of running is, I would say this to a gold medal marathoner and my couch to 5K person, 3 months. No running until 3 months. Now, I personally have a postpartum return to run program that I developed. And in it, at 6 weeks, I have my mama's, like, starting to, like, sprinkle in some impact stuff. So at 6 weeks, if you've been totally clear for everything, I have you start doing, like, the most simple, gentle little running in place for 30 seconds. And that's it. And then, week 7 or week 8, I have you starting to do, like, little bunny hops kind of thing. Because I feel really strongly that you should wait to do sustained running, and sustained, again, 5 minutes. Even 5 minutes is a lot of impact. And, like, over that 5 minutes, you hit the ground a lot. I say wait to do that. But I also feel really strongly that if you go from 0 running for 3 months, because some women run all the way up till, they give birth that day. So the minimum would be 3 months of no running. That is a long time to go. And then all of a sudden, even do 5 minutes of running. So I want to sprinkle in that, like, impact in a very regimented, like, cautioned way, so that your body, like, starts getting used to it, but not in, like, 5-minute intervals. It's like 30 seconds and then stop and go do bridges on the wall to, like, make sure everything's, like, pulling back up and in, and do some Kegels, and then do another 30 seconds of little jogging in place. And so this is where I feel like it's so important to have somebody advising a woman, especially a woman who really wants to get back to, like, running, like, serious running, advising on those, like, from 6 weeks to 3 months time, because you need to, like, start getting the impact in a really segmented and, like, regimented way, so that you can safely start at 3 months. You start a couch to 5K program, which is, like, jog for a minute, walk for a minute for 20 minutes, and, like, but that's a lot of impact. So I don't want somebody going from 0 to that, but I also don't want them to, run in that time. So that was really
it sounds like that you're breaking down what it takes to run. You're basically breaking down and then building back up before they're ready to do that. Yeah. So is this something that starts at 6 weeks, or is there something that you recommend your mamas do? Kind of like, hey, let's meet at 6 weeks, but how about you do these things from, like, 2nd day postpartum to 6 weeks? Because some people are itching. They're like, what can I do in this hospital bed to get my pelvic floor back? So what are some of those recommendations before even the 6 week check off?
So this is where it's, like, such a, like, double-edged sword or something like that. Like, a lot of doctors say don't do anything, and then at 6 weeks, go do whatever you want, which I also really firmly disagree with, because I always kind of just step back for people to like understand a little bit better. If you had ACL surgery, which a lot of people understand, ACL surgery a lot better than like a pelvic floor thing. So if you had ACL surgery, you leave the hospital with a plan, like a 3-month plan, and you start exercises like that day, basically, like very simple little, you're squeezing your quad and releasing your quad, like really simple things, but you start right away. So I tell women, or, I also, my program, I have a postpartum return to run program, and then just a postpartum rehab program. And they both have exercises starting basically day 1 postpartum. Now, when I say exercises, personally, like exercise means anything from like just a slight muscle contraction to, like jumping jacks and whatnot. So I say exercises, and I always am like, take that lightly. I'm not having women doing jumping jacks or anything crazy day 1 or even 6 weeks, but they're like lying down in their hospital bed or their bed at home, and they're doing little breathing exercises to re-engage their core and engaging their pelvic floor as well. Of course, if they had a lot of stitches, I am like, just do breathing exercises and like engage your deep core muscles and get that started. And we'll start on, some Kegels and that type of thing once, like the healing process starts and maybe any swelling and discomfort kind of goes down. But yeah, I firmly believe that some gentle exercise as soon as possible is the best way to set your body up for, no dysfunction down the road. And I also tell people, like, the pelvic floor is made up of muscles just like other places in our body. So if you injured your quad or you injured your bicep, you wouldn't just like sit there and do nothing, right? You would probably, or if a physical therapist was advising you or a doctor or something, you'd probably do like a little massage, you'd do like some gentle movement, you'd keep things moving so it didn't just get stuck and tight. And so that's where it's like, okay, let's find a nice happy medium here where doctors say, like, don't do anything and then go do whatever you want. And then, that just feels, both sides of it feel like not quite right. And that's where it's like, okay, just refer to a pelvic floor physical therapist, because that is our specialty. Like, doctors are there to make sure mom and baby are alive and healthy, and they are very, very important, obviously. But there's also like all this stuff going on in mom's body that, they're not as concerned about because they just want to make sure everyone's alive and healthy, right? And so that's where pelvic floor physical therapists come into play, is like, we know what you should be doing, and like we can advise on that. And we have, research on how muscles work and how muscles heal and rehabilitate. And we can apply that to pelvic floor and safely get you to your 6 weeks doing some things. And then you get to your 6 weeks and then you start doing, maybe higher level stuff because your doctor has cleared you and whatnot. So
yeah, and I think that's huge, because a lot of times, like, people don't even know what normal is, because postpartum people who start running, they might be feeling that, oh, I feel different because I just had a baby, but they don't know what is the normal different and what is a symptom of something. So as you said, like in the very beginning of this, is the lack of education. They don't know what to expect, right? Because they just went from don't move, don't lift anything to go live your life in like one day, essentially, right? So that's 6 week mark.
And also, I just always like to say this, because I don't want to, like, doctors are great. Again, they keep mom and baby alive, and that's the most important thing. But they also say, like, don't lift anything, don't, squat, don't do this. And I always remind my mamas, I'm like, well, you can lift a little bit, right? Unless you have had a C-section or you've been like put on no lifting at all. But unfortunately, there are plenty of women out there who don't really have support, and they still have to, they lift their baby, right? They lift their baby in the car seat at least. So that's like at least like 12 pounds, like probably, diaper bags. Some women have to climb stairs to get to their house, to get to their bedroom, so I always say, like, doing absolutely nothing and not lifting anything is not really realistic. So since you are probably going to be lifting some amount of weight, at least 5 pounds, because at least baby, right? We can wait a little bit, and it's not going to kill you to do a couple of Kegel exercises when you're lifting, 12 pounds in the carrier and stuff. So I always, I've said that to moms, and they're like, oh, yeah, that makes total sense. Like I can do a couple squats. I squat down to sit on the toilet every day, or, to sit at my dining room table. Like, okay, like I feel, and they're just like, thank you for saying it like that, because that makes sense. And like, I shouldn't be so scared to do a few exercises. Like I'm going to just wreck my body when I do these things every day. So I always like to remind people of like functional movements.
Yeah, functional, because I think that's great, because I think that's when they see that these are things that I do through my day anyway. I just have to kind of learn to do them differently, which is actually safer on my body instead of like, using bad body mechanics. So coming back to our like 6-week landmark, while that is great, and we talked extensively about why we need to at least wait till 6 weeks for tissues to heal and then train yourself to run, but what can we look at, or what are we looking at when we see moms that have already started running? And I sometimes get people at 6 weeks postpartum for a screening, and they have already been running 3 times a week, 3 miles. And now, are there some of our patients that for them it's okay to do that? Like, is it even like, what are the objective things we want women to know that, hey, if you can do this, good for you, you could be running at 6 weeks? Like, or is there like an absolute no? Like, what are we looking at?
Yeah, I mean, and I hate saying this because I'm a runner myself, and when I have an injury and I can't run, like, running for me is like one of those things that like gives me, like it helps my mental status, right? It's more than just exercise. So I understand how hard it is to tell people don't run. If I had that patient come to me, I would do my due diligence and say, I really think you need to stop running and take another 6 weeks off, wait till 3 months, do these exercises. I would give them, I'm not saying like stop everything. I would say maybe try spinning, maybe try swimming if you've been, cleared obviously to swim, do some cross training stuff, but something without impact. And I would be really strong in that and just say like, I understand your need. I really, really do. But there are other things you can do that are a little safer for your body. And then at that 3-month mark, we'll get you back to running, and you'll be really happy that you did.
Yeah, I think
not everybody's going to like listen to that. And if I have a patient that just tells me like, I'm going to run, like you are not going to stop me, then I will be like, okay, these are and I'll like explain the risks. And then if they still say that, they're going to run, then I'll be like, okay, let's do as much strengthening as possible. Like I'm not going to just shun them and judge them. I'm going to be like, all right, that is your decision. Let's make sure, like, let's do some things to make sure you know how to keep your body strong and your pelvic floor engaged, and to set you up as best as possible. And
and that is so important, because I feel like, as you said, it's never just about running. It's, if there is a deeper why to runners, right? Some people, it's their mental sanity, and postpartum is rough, right? So if running is one thing they can hold on to, I feel like sometimes women then hide it from their providers that I have been running, because they don't want to be scolded or reprimanded for it. So I think,
and I know, like, when you tell somebody don't run, it's quite possible they're just going to be like, all right, I'm not going to see that person again. I'm going to go find somebody who will tell me I can run. So I try to just be like, please don't run. And then if they are like, I'm going to run anyways, I'm like, okay, then I want to help you. Please don't leave. Like, I want to help you still. And like, I understand the need. So yeah.
So now we're talking about like, in these 12 weeks, we're basically going through progressive strengthening and breaking it down to add impact enough where they get to a point where they can tolerate impact. So what are some of the things that you're checking off before we say that, okay, you can now go to running?
Yeah. Making sure that we do internal exams. So making sure they can do a Kegel or a pelvic floor contraction, disassociated from breathing, but also with breathing. They can do, leg motions, like they can basically do a Kegel with any motion, really. I personally don't have biofeedback unit, but I would, if I did, I would love to have biofeedback unit in and have them do some like plyometric jump squats or something with it in, and like see how well they can, squeeze and hold with that. Also make sure like they have good understanding of breathing patterns and how to like engage their pelvic floor with that. And then just some general strengthening stuff, watching form, checking them on a treadmill, a little bit of quick form there. And then, no prolapse symptoms, no pains, and just gently starting to like add some impact, add some running, and see how they do. So it's obviously like really dependent on each person. Like it's so hard to like cookie. And when I made my like programs, it was so hard because I kept being like, oh, but what if they had a C-section, or what if they are having these pains or something? And then I had to like remind myself, like, okay, this is an umbrella program, and like I have like little things written, like if you have any pain or any symptom, like tell me.
I know it's hard when you're making such an umbrella, because then you keep going into these rabbit holes and you're like, but what if that, but what, and we kind of, and that's where we kind of have to remind ourselves as clinician, as some advice is better than no advice. And then when you have that person in front of you, you can individualize it. But, anything you say is going to be better than what they just randomly read on internet, right? So I think it's hard. I feel your pain, because sometimes I run into that as, but what if this, but what if that, right? So
right,
now,
and anything is better than nothing, which I just wanted to like say really quick. Like I have moms who, are on my program, and they'll email me at 4 weeks. They're like, oh my God, I haven't done anything. Like I've been so overwhelmed. And I'm just like, or they're like, I've only done like 1 exercise a week. And I'm like, you know what? That is better than nothing. If you can only get to 1 exercise a week, that's better than 0 exercises a week. And if you've watched some of my videos and education stuff, you know a little bit more than you did, and that's better than nothing. So like you're still doing a really great job, and it's a crazy time postpartum. And so yeah. So I just wanted to say, like, it's something better than nothing. So
it always is. I feel like postpartum life is, you don't know what you're signing up for. So day 1, you feel like, tell me what I need to do. And week 4, you're like, I didn't do any of it because I just didn't have time, right? Yeah. So like, what is your advice for mothers who are running, who have kind of gone through their strengthening program, and not necessarily your program, but mothers who are past that 12-week mark, they have been running, but they have stress incontinence with running. So there is this like, okay, stop running, pad up and play on, and ignore this, do pelvic PT and still keep, like, what is the advice that we're giving these moms who are leaking with running?
Yeah. If you haven't been to a pelvic floor PT, definitely get in to see one. That would be my first piece of advice, because I have to tell people, especially if it's related to postpartum, or, maybe they're like 6 months out and, that's their only symptom. It could be that they had some tearing during birth and like they have some scar tissue, or like their pelvic floor is, really tight and they're not able to like actually get the strength to hold their pee while they run. So they might need some, a lot of people think, oh, I'm just going to do Kegels. But really, you and I know, like sometimes it's the opposite. Sometimes you got to like stretch and like get some mobility of the muscles so that you can strengthen them. I always use the bicep as an example. Like if you can only straighten your arm halfway, and then you do like a bunch of bicep curls right there, like that's not going to really strengthen your bicep, and you're only half as strong as if you could straighten all the way out and then curl up with a weight, right? And so I always say that to my patients, like give that example. So first and foremost, like if you haven't been to a pelvic floor PT, go see one and just kind of get a baseline for like what your strength is. If you're able to do a Kegel, I mean, I have so many women who think they're doing Kegels and they're just like kind of clenching their butt, or they're not really engaging their pelvic floor muscles, and not to their fault of not their fault at all. It's just they needed some visualizations, they needed some more tactile cues of how to actually do one, and then a couple weeks of just a little bit more focus on the pelvic floor and learning how to Kegel appropriately, and their symptoms go away a lot. And then there's, of course, going to be some patients who, it's a little bit longer road and they really want to run. So, I try to equip them with different things to do to try to help their incontinence. And sometimes it might be, okay, wear a pad for now. Again, it's really individualized when, I'm seeing a patient in person. It depends on why they're having it, how long it's been since they've had babies, and like how long they've had the incontinence. I often say like even if it's been 5 years, you can still make a difference. If it's been 40 years and you had 5 babies, forever ago, like maybe we're not going to resolve your incontinence 100%. And I'm not going to sugarcoat it. Like, we probably won't resolve it 100%, but we'll make some difference, right? Like education and just like a little bit of strengthening. It might improve you by 50%, which is better than 0%.
Yeah.
So, yeah, I would never just say pad up and push through it. Unless I had seen the patient and like we had talked about things, and she, you know, like the times where I'd probably say that would be like with a patient who's like, I need to run. It's my only stress relief. Like, please don't take it away from me. And then I'd be like, okay, these are the risks of it, but let's do it. Let's figure out a way for you to run, if that's like how you de-stress.
So basically, incontinence is a symptom of something's going wrong. So while you don't ignore that by just continuing to do what you do, it's okay to continue the activity if you're kind of addressing what is the underlying cause to that, right? And at least I definitely see this a lot, that sometimes the issue is not even in the pelvic floor. You know, we get so caught up in like the people like, yes, I've been doing Kegels, and then I do Kegels when I'm running so I don't leak, and it doesn't work, right? So very good point about the flexibility of that muscle, because if it's just stuck there when you're running, at one point it's going to get tired, right? So I think that helps women to put things into perspective of like, maybe like, while I don't have, because I feel like sometimes the barrier is, oh, if I go to a pelvic PT, she's going to ask me to stop running.
Right.
But I want to, so I'm just going to put a pad on and keep running, right? So that's not, we don't do that. We let you run if you want, if that's what you really want to do.
Yeah. And also, you know, just other modifications that some people, you know, we're trained to think about these things, right? We're physical therapists. We're trained to think about these things, but other people might not. Like, time of day that you go running makes a big difference. If you are an evening runner, that might really make your incontinence worse because you're fatigued. The pelvic floor, again, is muscles, just like other places in the body. And so after a long day on your feet, chasing kids, at work, whatever you do, your muscles are going to be more tired. So it's going to be harder for them to engage while you're running and keep you continent. So it might be like, hey, why don't you try your runs in the morning so that you don't have as much incontinence, and then you can do your pelvic floor strengthening routine stuff that I'm giving you in the evening, and we can work with that. And it also, you know, it has to do, like, if you're really constipated or you haven't had a bowel movement, that's going to put more pressure on your bladder, which people don't think about and people don't really understand, because, you know, I do a lot of education first thing, like with patients, and I show them the pelvis model and where the bladder is, where the uterus is, where the rectum is. And I'm like, look at how close everything is. Like, if you have a big bowel movement that hasn't come out, I mean, it can push on your bladder.
And I think the day and night variation, prolapse people kind of catch on to it just by themselves. Like, it's worse when I run a certain time of the day or certain time of the month, right? But it's very hard for incontinence people to make that association. So now let's talk about like women with diastasis. Like, what are sort of like the considerations for them when it comes to running with a diastasis?
Yeah. Diastasis, I feel like, is getting a lot of media, or, you know, like it's out there right now. A lot of people there's a lot of like fear around it, and like, oh my God, I have patients who like really are very concerned about it. And, you know, of course you want to be concerned, but I also remind people, like, because of our anatomy, like we really have to have basically a separation to grow baby in your belly for 9 months. So like, it's okay. I always just like, okay, it's all right. It happens. And, you know, prevention of it, or, you know, trying to work to prevent further diastasis is important. And there are things you can do, and education and whatnot. Postpartum is, you know, definitely when you want to start working on it and re-engaging your deep inner core. I tell people, you know, some women might have what I call a functional diastasis, meaning they're going to have a separation the rest of their life because their body is just not like fully going to bring those rectus abdominis muscles back together perfectly. But if you can engage your deep core, your transverse abdominis, and I can feel that you have like good tensioning, and you can do a bunch of different movements, you can do planks, you can do squats, you can, you know, engage in like all these different functional ways, and I feel like a good tensioning, then I'm going to say you're good to go. You might always have to be a little bit more aware of the fact that you have this and always be working on it. But kind of digressed a little there.
Mhm.
I like to just tell people, like, it's okay. You might have it, unfortunately, you might have some separation the rest of your life. It might just completely resolve on its own, kind of thing. But so running with it depends on the time, of course. Postpartum depends on if you are able to do functional movements and engage your transverse abdominis and you feel good about that. Depends on your symptoms. So, if you've been working with a pelvic floor physical therapist and you're strong, you understand your body, then I would say yes, you can run with it. And again, I feel like every question is like, asterisk, it depends on the person, depends on what they've been doing, it
Correct.
depends
Yes.
on all this. So, again, I want, if, somebody's listening to this or watching this and they don't have a pelvic floor person around, like, I want to give them enough information where they can be like, okay, I can like help myself some. I don't want to just be like, go see a pelvic floor, because that's not realistic.
Thank you. And that sort of is the point of this podcast anyway, because not every one of our listeners has access to a pelvic floor PT. And sometimes they're not in the time in their life where they can access care. Even if there is a PT down the block, sometimes just life doesn't allow you to take care of yourself. So if you're listening in, I just want people to kind of like walk away with like one thing I can do, right? So we do understand that it depends, like most things, which is sort of like a perfect segue into my next thing. So anytime you talk about like anything medical, right, all of us start with like, it depends. And it truly does. And the answers are really long because they're very specific. But the next segment is it's more for the fun component of it, while at the same time giving knowledge, right? It's called the one thing. What that means is I'm going to ask you a few questions, which are basically like a quick, what's the one thing, right? It's not supposed to be, it's not supposed to be clinical advice that, we are held accountable for, but I often get asked by patients, like, what's the one thing I can do for this and that? So this is just for that fun piece. Are you okay with like that segment?
Yeah, I know. And I'm going to try to just give one thing. It's going to be so hard.
I know. People often like us, like, can I just do two for this question? Can I do two? So, I mean, feel free to jump in with 2 or 3 if you need to, right? But like, this is, as you said, the point is just like, okay, we're in a generation where people are like, get to the point,
Yeah.
So let's start with the one thing, right? What's the earliest? What's too soon for postpartum people to run?
I say wait 3 months.
Okay. What's the one thing you tell people when they're hesitant to wait?
Think about your future self. Like right now, running sounds really great, but I also running like for the rest of your life, if you want to, sounds even better, right? So another 6 weeks or the like 20 years. Just think of it like that.
I know. What's the one symptom that you're worried about when people run too soon?
I would say prolapse.
Okay. And what's the one thing or one exercise that you think helps people kind of, get to their running? Like in the early postpartum period, if somebody can do one exercise, what's that one thing that you think is going to help? I know you want to say 5, but just one.
Okay. I'm saying this exercise because I think it's really functional or not necessarily functional, but I really love it, especially to help prevent prolapse and help engage the pelvic floor. But it'd be bridges with your feet up on a wall. So you're like really lifting your hips and you're getting gravity. If you want to see a video of it, I have it on my YouTube. So like I could send it out, but bridges on the wall with your feet up on a wall and you're lifting your hips up and down and like Kegeling. I think that's, if I had to say just one.
I know. And I'll look it up and put the link in the show notes.
Okay.
What's the one thing you want postpartum moms to know, to look for? Like if this happens, I need to speak to a doctor, a PT, somebody. What's that one thing?
I would say like heaviness symptoms. So prolapse symptoms, again, like heaviness, pressure, you feel like a tampon is falling out of your vagina, any symptoms like that. I would say prolapse is what I'm the most worried about because of the long-term repercussions of it.
Okay. What's the one thing women should do during pregnancy to ensure that they can return to running postpartum?
I would say see a pelvic floor physical therapist so that you're educated and understand your body, but I know not everybody can. So like research. I sometimes don't like saying look online because there's so much out there that can like be terrifying.
Mm-hmm.
But I mean, I guess I would say go to my website. You know, I'm not trying to like plug myself, but I just know what I've written is helpful and not fear mongering and whatnot. So I would just say, try to learn about your body, try to learn about the pelvic floor and understand what is going on right now during pregnancy, what's going to happen during labor and delivery, which can be scary. And then what happens postpartum, and like just understand and get a feeling for where your pelvic floor is and what it does. Because I think knowledge is power. And that's like half the battle with most women, is like just understanding what the pelvic floor is and where it is. I mean, that's for everybody. You know, I've had men tell me like, oh, I don't have pelvic floor, so like it doesn't matter. And I'm like, all have pelvic floor. So just getting that over that barrier.
Yes, of course you don't. Nobody has a pelvic floor until they have a problem with it. That's when they know they have a pelvic floor, right?
Exactly. And half the problems would be prevented if everybody just knew what the pelvic floor was. So.
All right, that was all of my questions. Thank you so much. I really admire your passion about running and, you know, kind of putting it with pregnancy, postpartum people. And I'm really glad I met you where I met you. So, you know, I'm just looking forward to like collaborating some way or the other in the future. But I want to give you a couple of minutes to tell our listeners where to find you, because I think she's awesome. And if you're a postpartum runner, you do want to find her. So, you know, I'm sure she has different ways or means of social media to find her. And with, you know, telehealth, I don't think you need to be geographically located next to her. So go for it. Where can our people find you? And also kind of identify who are the people you like working with. Yes, of course, postpartum runners, but if there are other things that you enjoy working with, people might be listening and who would, you know, want to reach out to you.
Well, general anything pelvic floor, like I'm really passionate about. I've recently helped 2 males, one person in Hong Kong and the other person on the East Coast, who found randomly a blog post I did on obturator internus pain, which is really deep hip pain, that both of these patients had seen like over 15 doctors and had every MRI and all this stuff, like, and found a blog post I wrote, and they're like, oh my God, those are my exact symptoms. And like, I've, gotten them on the road to recovery, hopefully. And that was all obviously virtual because I'm here in California. So, I'm super passionate about just like educating and helping people in general about the pelvic floor, because I think knowledge is power again. So the more you know, the better you off you'll be, or you can like help your mom or your grandma or somebody who maybe says in passing, like they might have an issue and you're like, oh, I one time heard this podcast by this woman and maybe you should check her out. We can help a lot of people. So, and then, like my really like a woman who runs because it fulfills her and like really, like mentally helps her like feel better. That's like my ideal patient. Like I love working with her because making sure people can get back to running safely and efficiently and achieve their goals is like just fills my heart up. So those are my patients, but I love peeps. Yeah, I really love just educating. Like I get really amped up and I get on soapboxes all the time. So like if you just want to like ask me questions too, that's fine too. But so my website is veritypt.org. So Verity is VERITY. I have it on my mug here. Verity. Oh, it's probably backwards.
Pretty cool. No, I'm going to put it in show notes, so don't worry about like spelling it out.
And then I have Instagram. I'm not the best at social media, so there's stuff there, but not the greatest. Verity_PTW. And then I also have Facebook, Verity @VerityPTW. So physical therapy and wellness is what the PTW is. And then I have a YouTube channel that honestly right now I have a lot of videos on. I just can't think of what my handle is, but I'm sure if you search Verity Therapy and Wellness, you find me. But we can put it in the show notes too. So yes, I have a lot of resources. I'm not the best on social media. I'm working on it. I do every Monday evening at 7:30 Pacific time. I do a little chat Instagram live with a woman who's a pregnant and postpartum personal trainer, and we just talk about random pelvic floor stuff. in regards to running and exercise. So if people want to just like it's normally like 10-15 minutes, so super short. So if people just want to check that out, that works too. So, and also you can just email me. Like, I love it when people just reach out, just are like, hey, I read this blog, it was super helpful. Like, or if you have questions or something, like, please don't hesitate to email me too. And we can put my email in the show notes. I don't mind.
Yeah.
I love getting emails from people all over the world, which I have. And it's
Okay, cool. Well, thank you so much for taking the time. I know we've been talking about this for a while, and I'm glad that we finally, stars aligned for us to find the time.
Finally, yeah.
And I actually met Carolyn in one of the running courses. That's how we met, and I've taken a sneak peek at her program when it was in the makings, and it is pretty solid. So those of you who are interested, find her on the World Wide Web, okay?
Like when I met Darshana, I was like still like just had it on an Excel sheet and was like, I'm really passionate about it. And then just a few weeks later, I started like doing the videos, and I'm not like super techie. I'm a PT, and my videos are kind of hilarious. Like when I watch them, I'm like, oh my God, so embarrassing. Like they're not high production or anything, but again, just getting the word out there as much as education as possible. So, yeah, now it's like got videos and pictures, and I'm so proud of it. But
yeah, you have put in a lot of work, so I'm sure it's like your baby. You're proud of it. And I think every time we take our own video, it could be whatever quality you want. You're gonna always look at it and be like, did I just do that? All right, thanks again, Carolyn. I hope you have a wonderful rest of the day and a week. And peacing out, people. Bye. Thank you for listening in. I hope you enjoyed this episode, and I really hope you got something out of it. I appreciate your time, and I enjoy hearing back from you guys. So if there are any questions, comments, or concerns, you know where to find me. If there's a topic that you've been wanting to hear about, reach out to me and I'll see what I can do. Once again, thank you for being here. Stay safe, and don't forget to come back. Peace out.